Hi, I'm Manvir Singh. I'm with Pure Life Health Center. This video is about neck pain and neck pain solutions if you've suffered with neck pain for even 12 months or more. So I'm going to show you appropriate application of heat technique for the neck. We have a nice little heat pack here. And what you want to do is, as long as you're not having acute pain, if you respond well to heat, you don't have any skin sensitivity, you can take a heat pack, and hopefully it's got this little strap like this, and apply it directly to the neck. And with the weight of this pack, it's going to put nice moist heat right into my neck. We do sell options for home, so you can get these microbead moist heat packs. So with the moist heat packs, you can get these high quality moist beaded heat packs that are microwavable. They're nice and heavy, so they put weight on the shoulder and they create heat right into the neck area. So point number 2 is to get soft tissue therapy. At our clinic, we do something called STR, or soft tissue release technique. If you get trigger points, maybe it's in the traps, maybe it's in the deeper neck muscles. Oftentimes, you're trying all these things, medications, you're trying to massage it yourself, you can't really get to the tissue. Firstly, you need to understand the anatomy, for example, where that muscle is, what the restriction is, and how to release it. So release techniques are very effective. They're research proven to create almost instant relief, and it doesn't take too much to get into that tissue, create erythema, which is localized blood flow, and improve the circulation of that muscle. Oftentimes we get the question, do you stretch or do you not stretch? Usually if you're recovered from injury, your pain has generally gone away, you're just suffering from stiffness, stretching is great. We prescribe stretching. But if you're in an acute injury, if you're having pain, and you're not getting the results that you need to from stretching, it's probably because you have an underlying muscle weakness. Studies have actually shown that the deep muscles of the neck are replaced with fatty acid deposits, and the number one reason being that we don't strengthen the neck appropriately. So you can't stretch away fatty acid deposits. What you need to do is preventative strengthening. So the first thing that we show is when people get into acute injuries is strengthening exercises. Or even people who have chronic injury and haven't done strengthening exercises before, we'll teach them those same exercises. One of the things that we talk about and we educate our clients is the importance of stress release. There's a few techniques that you can easily use. One of them is just deep belly breathing. Really effective. It can reduce muscle tension, it reduces stress, and other things are just basic aerobic exercise. If you haven't been out, especially with the snow out right now, just having a nice walk in nature can significantly reduce stress. We also talk about other techniques, other influences on stress, but it's really important that, especially when it comes to the neck, when you're carrying tension, you're using different muscles, your breathing pattern changes, you're using muscles that aren't necessarily supposed to be used for regular breathing, it increases tension. So stress equals tension in terms of neck pain. Okay, I'm going to show you exactly how you can test yourself and see how well your posture is and what you need to do for corrections. What you want to do is just align your hips into the wall, with your shoulder blades into the wall, and have your feet pretty close to the wall so that you're nice and upright. And all you're going to do at this point is see how much work does it take, how much pressure do you feel with your shoulder blades, just bringing your hands back to the wall, and how far do you feel you have to go to bring your neck to the wall. What you'll really notice is if you have a really curved posture, you really have to go back. In fact, you're going to have to move your spine to move backwards. That really shows that you have a lot of postural stress or strain, and you really need to do corrective exercise. If you find that maybe your left shoulder feels like it's touching and your right shoulder's not, if you feel like you really have to move your spine to get your neck back, you might have some postural issues that need to be worked on. So here we have a diagram of the neck. You can see a normal neck. What you don't see is oftentimes the wear and tear that occurs, or the compression of the spine. So what I have here is a neck decompression device, which you can buy from our clinic. What it basically does, it attaches to the neck, it can decompress the neck. This is just one of the techniques that you can use. There's a few other techniques that we can also discuss in the future. So I talked about strengthening the neck. Studies have shown that after acute injury, the muscles of the neck get significantly weakened, and especially the deep neck flexors. So it's really important to strengthen these deep muscles, and these are not ones that you see. It's not the muscles that you visibly see on top of your neck. They're really deep muscles. It's similar to the concept of your shoulder. You have your rotator cuff and you have your bigger muscles on the shoulder. You also have your deep neck stabilizers, and you have your neck mobilizers. And it's really important to work on those deep muscles to avoid, again, fatty acid deposits from developing that deep muscles. So for a summary of all these tips and the deep neck exercise of the neck, you can download the detailed guide that's attached to this video. So if you're in pain, feel free to respond to these videos. We'll answer some questions in the comment section. You can contact us on our website. We can answer your question, or we can just talk to you on the phone regarding any problems that you're having. And just get in touch with us. Just call us at 604-496-4325. Check out our website, get in touch with us, and we'll help you and we'll answer any questions.